Okay, I'm gonna try to make this video a little quicker because she said she's gonna use these images. So here in the abdominal cavity, this right here is your diaphragm. The xiphoid process is literally just like the tip of the sternum. So your sternum goes all the way up. This is the tip. It's the xiphoid process. Your ribs would come down here and then here. This margin is the right costal. Costal just means rib. So right costal margin would be this whole thing. So then this whole thing right here would be left costal margin. Abdominal aorta is the one in the middle. And then you can see the vena cava hugging it more to the right side of it. This is the renal vein. The IVC will go up into the right side of the heart and the right atrium, so it's going to be on the right side of the abdominal aorta. So anytime you see these two big vessels, aorta is going to be more middle or left of the IVC, and then IVC is going to be on the right of the aorta. Oh, this is just fat. I doubt she'll ask about that. And then this is the psoas fascia because you can still see the white stuff, but the muscle under it, the big muscle, is this right here when you can see the red stuff. This is the psoas major. And this is an important muscle because all of the lumbar nerves that she wants us to know are based off of this muscle. So with the psoas major, you're going to have a nerve medial to it, which is called obturator nerve. Anterior to it is genitofemoral or femoral, whatever. And then lateral to it, you're going to have 4. You're going to have femoral. Then lateral to that, you're going to have lateral femoral cutaneous. Then on top of that, or so technically more lateral and superior, you're going to have 2 that branch off of L1. 2 off of L1. And those are your iliohypogastric and ilioinguinal. We'll see those a little, but that's why this muscle is important, because that's what determines, or these nerves are like in relation to this big muscle. We already saw abdominal aorta. We saw IVC. Psoas major. So abdominal aorta will split into a right common iliac and a left common iliac. Now, anytime you see the word common, that means it's going to split again. So this eventually lower will split into an external iliac. That was like the worst color to choose. External iliac and then internal iliac, and then same thing here. Eventually be like internal iliac, external iliac, whatever. Because we're still like in the abdomen, what you see here is actually the sigmoid colon. The rectum you can see more in the actual pelvis itself, and then this right here is the bladder. So sigmoid colon. So the way the large intestines go is you have your cecum here, ascending colon, transverse colon, descending colon, leading to your sigmoid colon, and eventually rectum. This is the next lab stuff, but this is just to show you that this is the sigmoid colon. Over here, I don't think she'll do CT scans, but if she does, this is like, imagine you have a patient laying, so their head is all the way to the back. So their head's all the way in the back. And then technically you're looking as if they're laying on their back, and you're looking at them from their legs up, but you cut them at a certain spot. So you cut at like the abdomen at this level. So you're literally cutting right here, and you're looking at this direction. So this is what you would see in front of you. So these 2 bigger muscles, round, that come off the transverse process are your psoas major, which is these. The one right behind that has more of like a square shape is actually your quadratus lumborum. And we'll see that as well. So yeah, and then this is psoas major. Sorry for the bad handwriting. Okay. Next, this slide's whatever. It just shows an X-ray. So technically your psoas major should be here. Next one. So this is the quadratus lumborum. So it's more like a square, or not a square, but like 4 sides. That's why it's called quadratus lumborum. The medial side of it is like under the psoas major, so you can't even see the full muscle. So it's technically like this. But you see the psoas major, lateral to it, you see a 4-sided muscle. It's the quadratus lumborum. Next, so the difference between quadratus lumborum CT and iliacus CT. So let's go over the iliacus really quick and then we'll come back to the slide. So this is your pelvis. The top bone, this whole thing is called the iliac. This divot inside is called the iliac fossa, and the muscle that goes through that whole fossa is called the iliacus muscle. So this right here is the iliacus. If you look at the CT scan, if you want to see the iliacus, you would have to cut the patient at a lower level, like right here. Whereas if you cut him at a higher level, you would see the quadratus lumborum. So this right here is your iliacus. You can see it's flatter compared to your quadratus lumborum, which is definitely like more round / squarish, diamondish, whatever. So that's how you can tell which level you're at, if you're at the iliacus or the quadratus lumborum. And then this is always going to be psoas major. Okay. Transverse abdominal muscle literally will just run horizontal. So you see lines, so on this side too, running horizontal, that's transverse abdominal. She doesn't have them on here, but for the other lab, external intercostals will run this way as if you're putting your hands in your pocket. External intercostal, or sorry, external abdominal. You also have these muscles in like the higher rib area. So you also have a transverse intercostal, external intercostal, internal intercostal, or whatever. Then internal will run in the opposite direction of the external. But for this sake, all you have to know is transverse abdominal. So if she pins any of these muscles, psoas major, quadratus lumborum, iliacus, transverse abdominal. Super easy. All right, next. This right here is the diaphragm. So this is going to be right side of the diaphragm, left side of the diaphragm, whatever. We already saw that. And then here you can see the diaphragm. So the diaphragm, when it's relaxed, is actually like this, because you have long, and then diaphragm goes like this. When your lungs expand, get bigger, when you breathe in, the diaphragm actually contracts and becomes flat. Those are all full lungs, but whatever. So yeah, so this whole thing is diaphragm. Big ass muscle going down like this, psoas major. Next. In the iliac fossa, iliacus. Easy. Next. Okay. So this is the lumbar plexus. This is literally the nerves that we just went over. So this top nerve right here is not part of the lumbar plexus, but it helps you identify that after this, we're going to start with the lumbar plexus. So it's not in the lumbar, it's the stuff above, and it's the last nerve from the stuff above. So anything like rib related is going to be in your thoracic range. So costal, rib, T, thoracic, and we have 12 thoracic nerves and vertebrae. So a submarine goes under, so the bottom or the last one is T12. So T12 subcostal. That just helps you orient the lumbar plexus. After that, these are the 4 lateral branches we talked about. So we said the big ass thick one right here, femoral. This literally goes into your thigh. Your big thigh bone is your femur. That's what's called femoral nerve. The one lateral to it just does sensation to your lateral thigh, to your thigh. So it's more lateral, so it's lateral, still going to supply the thigh, femoral, and then only sensation, so not like motor stuff, cutaneous. Lateral, femoral, cutaneous. She'll also label this as LFC. Now, over here, you can see, probably can't see it too clearly, but like these two, if you follow them up, will come off the same nerve. They both come off of L1. You can kind of see it better over here. So these are your HI, high. So ilio, first top one is ilio hypogastric. Bottom one is ilio inguinal. They literally start with I, L, I. So they're pretty much saying I am L1. So these are both L1. And then again, this is like an X-ray. She just shows intervertebral frame now. It's just like what spinal nerves go through. So she's just showing you like L1 would go through here, L2, whatever. Okay. We said the 4 lateral ones are iliohypogastric, ilioinguinal, lateral femoral cutaneous, and femoral. The one medial to it is obturator. So this is your psoas major. Medial to it, going into an obturator foramen, is obturator nerve. So it goes through obturator foramen, literally like a hole for the obturator nerve and artery, which we'll see later, to go through. So this is the psoas major, it's medial to it. The other 4 were lateral. This nerve that goes on the psoas major is the genitofemoral nerve. If you think about the psoas major, if you like went all the way across, it separates like your thigh or femoral from your middle or genital area. So genitofemoral makes sense. It also has 2 branches called the genital and a femoral branch, but we don't care about that. And that's the nerve we're talking about right now. So this thing right here. Literally, this is your psoas major, runs anterior to it. Genitofemoral. We saw iliac crest, we saw iliacus. And then this is what I was talking about, where it branches off eventually. So you'll get like a little branch here, going to the femoral side, femoral branch of genitofemoral, going to the genitals, genital branch of genitofemoral. Transverse abdominal, we saw the horizontal looking muscle. We saw quadratus lumborum. We saw all the stuff. The nerve roots, so let me go back up. Obturator nerve will be L2 to L4, so it's this green one. It'll come down like this and go through the obturator foramen. Now here, L1 and L2 is genitofemoral. So if you're keeping track of the other stuff, we said iliohypogastric is L1. Ilioinguinal, also L1, because they start ILI. Genitofemoral is L1, L2. Obturator is L2 to L4. Next one, femoral, that's the thick one going into your thigh. This one gets L2 to L4. And then lateral femoral cutaneous doesn't go as deep, so it only gets L2 and L3. And that's the one that's going more lateral compared to the femoral nerve. And then in iliohypogastric, we said they both come off of L1. It goes H, then I. So in the alphabet, H comes before I, or just remember, you're just saying hi. And they run anterior, well, the ilioinguinal nerve technically runs anterior to the quadratus lumborum. So if you want to like differentiate them even more, but as long as you see 2 nerves coming off of the same thing, it's going to be the H and then the I. Okay, bifurcation of the aorta and inferior vena cava. So aorta will bifurcate, we said. So this is aorta, right common iliac, left common iliac, external iliac, internal iliac, internal iliac, external iliac. So abdominal aorta, right common, left common iliac, right internal and external, left external, left internal. Anytime you see the word common, that means it's going to split again. And then IVC does the same thing. So IVC will give you a right common vein, right common iliac vein, and a left common iliac vein. For the aorta, it actually bifurcates at L4. Let me put this in red. Level L4. Inferior vena cava is just one level below. So this bifurcates at L5. So if she asks where they bifurcate, aorta is L4, IVC is L5. A comes before I, so it's a level higher. And then here you can see everything. Aorta, right common, left common, and that's going to split into internal, external, internal, external. Okay, sacral plexus. So you get your L4 and L5 from your lumbosacral trunk. They combine with S1 through S4, the sacral nerves. The bigger the nerve, the further down you go, or the bigger the number, the smaller the nerve. So S1 is bigger than S4. This is the sacral plexus. Eventually, all of these will become the sciatic nerve, which is a big nerve that goes to the back of your thigh. And the hole that it's going through right here is the greater sciatic foramen. This muscle that's under these nerves, going in this direction, is the piriformis. So you have two muscles that separate or go through two different foramen. So the way it works is this. You have your sacrum, and then you have a part of your pelvis called the ischium. This will make more sense later, but sacrum to ischial spine gives you your sacrospinous ligament. Sacrum to ischial spine, sacrospinous. Sacrum to ischial tuberosity would be sacrotuberous. I was going to put ligament. So when these two ligaments go, they'll create, so one will go like this, one will go like this, and they'll eventually like create like two big circles or holes or foramen. That's your greater sciatic foramen, and you have a lesser sciatic foramen as well. The muscle that goes through the greater sciatic foramen is the piriformis, greater sciatic foramen. The muscle that goes through the lesser sciatic foramen is called the obturator internus. Put M for muscles, piriformis muscle. So the way you remember this is you tell someone great performance. So the other one would just go through the lesser. So obturator goes through the lesser. Then this just says exactly that. So this muscle under right here, if you remove these nerves, would be the piriformis muscle going through the greater sciatic foramen. Okay. Well, we already gave it away, but psoas major, femoral, lateral femoral cutaneous. So this one has to be ilioinguinal. The one above would be hypo, so iliohypogastric. So this is ilioinguinal. External, internal iliac arteries. So we already saw how they split from abdominal aorta to right and left common iliac. Now we have, then internal, external. So when it goes down, this is like if you chopped someone in the middle from like top to bottom and you were looking at them in this direction. So technically this person is facing this direction. And the way you know that is if you look at the order of the organs. This is the pubic symphysis, which is like the most anterior part of the pelvis. You have bladder, uterus, rectum. So obviously we're looking at a female here because of the uterus. These are the branches of the internal iliac. So that means this right here, this right here, oh wait, yep. So this right here is external iliac. The internal iliac, the one in red, this whole thing is internal iliac. That has two divisions, a posterior and an anterior. So the posterior will first have an artery that's going to go up. It's going to ascend. That one is called iliolumbar. Or IL. The one going laterally to the sacrum is lateral sacral. And these are all arteries, so I'm going to put A dot. Or I'm going to say LS. And then the last one going to the back, specifically to your glutes, is superior gluteal, or SG. So the way I remember it is you start with IL, bring down the L, LS, lateral sacral, bring down the S, superior gluteal. That's the order they go in. Iliolumbar, lateral sacral, superior gluteal. That's the posterior branch. Now, the anterior branch has a bunch of branches, and they're kind of variable in each person. Like sometimes this artery will come off this other artery, but in some patients it will come off straight off the common iliac or something, or the internal iliac. So it's different in each person. So I'm going to just focus on these pictures because that's the ones that she's going to have. But these are some of the branches of the anterior division. Let me write it here. So anterior division, if you look at the organs, for example, in a female, you go bladder, then uterus, vagina's under, so I'm going to put a V here, and then rectum's in the back. So you're going to want arteries to supply all these. The first branch is going to be the superior vesicle, because something needs to supply the bladder. So the most anterior would be that. The next one, we already saw this, but it's the obturator, the one that goes through the obturator foramen. And these will make more sense when you see where they attach. Then you need something for these two organs, the U and V. So we have a uterine artery, and then it gives off a vaginal artery. Then you want something for the rectum, so you get middle rectal. And then you have two more nerves at the end. There's a nerve called the internal pudendal. This one's kind of cool because it has like a weird route that we'll see. And then the last one, the one that goes right under the superior gluteal from the posterior branch, this one's going to be inferior gluteal. So this, and this are the same in males and females. In males, however, instead of the vaginal and the uterine, so let's do, okay, instead of vaginal, we have inferior vesicle. So another artery that goes to the bladder, and this is instead of vaginal in females. And then males also have a ductus or vas deferens artery, and this is instead of the uterine. So the way you remember this is Viv, you dangerous dog. So instead of vaginal, we have inferior vesicle. Instead of uterine, we have ductus deferens. So Viv, you dangerous dog. And then this stuff right here will be important later, because this stuff does the water under the bridge. It gives off the image that we'll see later, but that has to do with the ureter. Okay. Next, so obturator artery, you see a branch. So this is the right common iliac, external iliac, internal iliac. These are the posterior branches. Coming off the anterior, you see a nerve going through this foramen, or you see an artery going through this foramen with this nerve. That has to be the obturator. So this here is your obturator foramen. So just look at where they're going, and you can figure out what it is. So here, you see them both going through this thing. So coming off the anterior, going down through this hole, has to be the obturator. It's not hitting the bladder, it's not hitting the vagina or the uterus or the rectum or whatever. It's going down into that hole. Next, we saw most of the stuff. We saw all this stuff. So again, obturator nerve going through this obturator foramen. Again, obturator. So you can see here that's going down into this thing. It's not hitting any of these organs right here. So that's obturator. Now, umbilical is technically the first thing that comes off of the anterior branch. So this is external iliac, internal iliac. It's umbilical, but this only really has a role when you're a fetus. Eventually, all it does, it just becomes the superior vesicle. So this thing right here is like the remains of it, which they clamped off, which had no use after you were not a fetus anymore. So superior vesicle, and you can see it hitting the bladder. So that's why I was saying, like, don't get too bogged up with like the order that they go in, whatever. Just look at, it's coming off the anterior, it's hitting the bladder, superior vesicle. Next, coming off the anterior, hitting the uterus, uterine artery. Now, we said the uterine artery will go to the ureter, but here you see a branch coming off of the uterine artery. It's going to go deeper all the way down to the vagina. So that's your vaginal artery. Your umbilical artery also comes from something called a medial umbilical ligament, or it's like the medial fold in your abdomen. So if she asks where does the umbilical artery originate from, it's the medial umbilical ligament. So imagine like you took apart your abdomen and you're looking at it from the back of the front. You would see these lines going across like this. This is the median. This is medial. And this is lateral. And the other side will be medial and lateral. So this right here is what gives rise to your umbilical arteries on each side. So if she asks, that's what it is. And you can see here, this is your medial umbilical ligament, gives rise to this umbilical artery. And then we saw the vaginal artery comes off the uterine artery. The same thing here. So here you see uterine artery going to the uterus. The branch of it would be the vaginal. Branch of the posterior iliac, we already saw this. The one going up is your IL, iliolumbar, going laterally to the sacrum is your LS, lateral sacral, and then going into the glutes, SG, superior gluteal. Inferior gluteal is actually an anterior branch nerve, not posterior. Okay, let me erase this stuff. So here, external iliac, internal iliac, iliolumbar, lateral sacral, superior gluteal, inferior gluteal. Now, this right here is one of the ones that I said has a weird route. So this internal pudendal actually leaves like this through the greater sciatic foramen, but then goes like psych, and it comes back and innervates like all of like the private areas. So it'll do like the sensation to your genitals. It'll do the motor to the sphincters that close and open when you're trying to urinate and all that stuff. That's the nerve that you block during surgery in that area, or to stitch up after childbirth. And the spot that you see this is actually on the ischial spine. That's like the landmark where you will numb the artery, or, well, the nerve is there, but the artery runs with it. You block the nerve, not the artery. So off of this artery, you'll get the middle rectal branch that goes to the rectum. So middle rectal comes off of internal pudendal artery. Vaginal comes off the uterine artery. Lateral sacral we already saw, going laterally to the sacrum. We saw all this. Iliolumbar technically has an iliac branch and a lumbar branch. I thought she would ask that. Here, what is this? So it's going out towards the thigh area, not into the pelvis with all these branching things. So that has to be external iliac. Going laterally to the sacrum, lateral sacral. So this is your pelvis, right hip bone, left hip bone. This is the sacrum in the back, coccyx. Pubic symphysis connects this pubis to this pubis. Where they join together is the symphysis. Over here, let me get rid of all of this, which I cannot. Okay, so this is sacral promontory. It's literally like the top of the sacrum, the little bulge that you feel. It's like how the back of the neck has your C7, which is like your vertebral prominence. Here it's a sacral promontory. And then I don't know if she wants to get too specific with this, but your pelvic brim, this is technically your ala. So your ala plus this iliopectineal line plus the superior surface of the pubic symphysis. And the other side will also have an iliopectineal line and ala all together make your pelvic brim. None of these are highlighted, so I don't think she'll ask. But if she does, this right here is your ischium. This is your pubis. So in between is ischiopubic ramus. And you can see it here as well. Pubis, because it's your ischium. So this is your pubis. This is your ischium. And again, sacral promontory, it's literally like this bulging thing right here. Top of the sacrum. And then we said ilium, ischium, pubis. On the other side of this, so inside is where you would have your iliacus muscle that we saw already. So it'd be on the anterior side because this is posterior. Your acetabulum, this thing right here, this is what your femur or hip bone goes into. Attaches. This is the ischial spine. This is the tuberosity below. So when we were talking about the things that happen, it's like from your sacrum, you'll have something that attaches like this, and then from your sacrum like this, and that creates like holes where things go through. So your ischial spine separates into a greater sciatic notch, and then this would be the lesser sciatic notch right here. And then this is a symphysial surface, because that's where, if you had two sides of the pelvis, so the other side would also look like this, whatever, blah, blah, blah. Just like this other side, and they connect right here at the symphysial surface. That's why it's called a pubic symphysis, like this. And then this is the iliac fossa I was talking about. That's where your iliacus sits. The one we saw with like the psoas major, quadratus lumborum, and all that stuff. And then here it's just comparing female versus male pelvis. The key thing she said is that in females it's wider and there's a bigger angle. And then what is this thing right here? That's the ischial spine. This is the greater sciatic notch. That's the lesser sciatic notch. All right, next. So here we saw sacropromontory, we saw all this stuff. This just shows the walls. We already saw this. This is the lumbosacral plexus going through the greater sciatic foramen. Behind is the piriformis muscle. Oh, this is the obturator internus muscle. So this goes through the lesser sciatic foramen. Unlike the piriformis, which goes through the greater sciatic foramen. Again, piriformis. Here you can see the piriformis clearly because they took out this lumbosacral trunk from here. So it does a good picture of it. And it's showing you going through the greater sciatic foramen, which is this big circle thing here. Pelvic floor. So what makes up your pelvic floor are your levator ani muscles and your coccygeus. Mostly your levator ani is the one that can like handle intra-abdominal pressure. So if levator ani gets damaged, then all the stuff that it's holding up starts to kind of drop. So like in females, you have a bladder, uterus, and rectum, and then vagina. What happens is if the floor gets damaged, then these will drop. So your bladder is here, but now your uterus is like shifted down. So these are very important. Levator ani is also most commonly torn in labor or childbirth. So these are your pelvic diaphragm muscles or pelvic floor. And then we already said bladder is the most anterior thing. It's right behind your pubic symphysis. The apex of the bladder is the most anterior. Remember A, apex, A anterior, base, back, B base, B back. So most anterior right here is apex. The back is the base of the bladder. So here, this is the pubic symphysis, this big brown thing. So this is the anterior now. So apex would be at the anterior, B is at the base, and then you just have a superior surface and inferior or inferolateral surface. And so right here, this is a male because pubic symphysis, bladder, this thing is the prostate behind the rectum. So there's no uterus here. This would be a male. Males only have a rectum and bladder, so they'll only have this pouch called a rectovesical pouch. In females, they have bladder, uterus, rectum. So they'll have two pouches. This pouch, bladder to uterine, is vesico, that means bladder, uterine. This pouch right here is called rectouterine, also called pouch of Douglas. All these, the clinical stuff, are also like in the actual study guide. So if you haven't done the study guide, like, this will make a lot more sense when you go through that stuff. But this pouch is where you drain if there's too much fluid. You specifically go through with something here called a posterior fornix. This is all in the study guide, so it'll make more sense there. Over here in males, you have, again, this is the prostate gland, base of the bladder, apex of the bladder, still sigmoid. We can't see the rectum yet. Here you'll start to get the seminal vesicles and vas deferens. So the way it works is you have seminal vesicles here. So I'm going to say SV, behind the prostate, P, then you have the bladder like on top of the prostate, B. So from the testes, T, you have something off the side called an epididymis. So this will have this big tail thing that extends from it. This is called the ductus deferens. That was like the dangerous dog mnemonic we used, or also called vas deferens. And this will carry sperm and join with the seminal vesicle or gland to give you this ejaculatory duct. So this right here is your ejaculatory duct, which is just ductus deferens plus seminal gland or seminal vesicle. They join together at the prostatic urethra. So the urethra within the prostate. Your urethra, you have a pre-prostatic, so it starts here before the prostate, then prostatic, then membranous, and then you have the spongy one that goes all the way down. Okay, urinary bladder, whatever. Okay, so this is the bladder. Imagine your bladder is like a face. The end of the bladder would be the neck. That's where you have the internal urethral orifice, or sphincter. That's what opens and closes and allows fluid to either stay in the bladder or leave the bladder. So during parasympathetic, so remember, sympathetic is fight or flight, parasympathetic is rest and digest. So like urination counts as parasympathetic. So during sympathetic, bladder fills. You don't want to urinate. So the detrusor muscle will expand or relax, and this will close. In parasympathetic, you want to urinate. So the detrusor contracts, so the bladder gets smaller, and the internal urethral sphincter opens or relaxes. So opposites in sympathetic versus parasympathetic. Again, that's also in the study guide stuff. Same thing here. We saw this. So the reason I was saying imagine the bladder is like a face is because this is at the neck of a bladder. Probably should have explained that before just drawing a random face. So imagine this is a face. The orifice is actually at the neck of bladder. Okay, let's apply to urinary bladder. So to the bladder, you're going to get the vesicle artery. You see an artery coming off the anterior branch, going straight to the bladder, superior vesicle. Okay, and then we said the medial umbilical ligament will give rise to the umbilical artery. So if you follow it up, umbilical artery coming from medial umbilical ligament. And then, I hope by now we know this, what is the piriformis going through the great sciatic foramen. That's right here, pubic symphysis. So anterior, apex of bladder. Male urethra, she doesn't have anything highlighted here, but so this is the bladder. Neck of the bladder is where you get your internal urethral orifice, and this whole thing is your urethra. So before it starts, it's prostatic, so before the prostate. This whole thing is the prostate. So in here, it's the prostatic urethra. Right here, just a little bit, it becomes the membranous urethra, and then all the way there, this whole thing is the spongy or penile urethra. So you can start seeing them here. So pre-prostatic, before the prostate, this whole thing is the prostate. So within the prostate is prostatic urethra. This right here is membranous, and then the whole rest would be spongy or penile, which you can see right here. And this extends all the way. So you have two muscles, corpus spongiosum and cavernosum. This is your spongy urethra, the one going all the way. So the muscle right above it, spongiosum, because spongy. This one, the cave-looking one, imagine you're like walking down a cave. I know this is like a weird time to talk about this, but like cave cavernosum, big cave cavernosum, they're on top of the spongiosum. And then pubic symphysis, so we know right behind is going to be the bladder, under the bladder is the prostate. These are the testes, and then this is the bulb of the penis. Okay, prostate gland. So this is your rectum, this is your prostate gland. If you're gonna have, if someone has cancer in their prostate, the way you do it is you put two fingers in their rectum and you can feel the back of the prostate. That's because cancer happens in the posterior lobe of prostate. BPH, or benign prostatic hypertrophy, happens in the median lobe, if they ask. So this is anterior, this is median, and the back is going to be posterior. So posterior is related to cancer, median is related to BPH. Okay, seminal vesicles. So vas deferens joins, becomes the ampulla of vas deferens, and then under is the seminal vesicles. So if she gives you this picture, the top V is V, vas deferens, and then under would be seminal vesicles. So vas deferens, also ductus deferens, first V, seminal vesicles, second word has a V, second V. That's how you remember it. All right, next. Under is the prostate gland, and under is the rectum. Rectum behind the prostate gland, because that's how you can figure out if someone has cancer. So this is your rectum. This is after it goes through the whole large intestine, whatever. And then under is the anal. So this is anal rectal junction. This whole thing is the anal canal. Between them is the flexure, anal rectal flexure. So bladder, rectum. You can see there's no uterus here, and you can see a prostate right there. So this is obviously a male. I mean, and you can see everything else, but so this is the anal rectal junction. So this is rectum, this is anus, where they join, anal rectal junction. The actual canal itself, anal canal. All right, this, we're not talking about the first V, because that would have been the ampulla of vas deferens. We're talking about the second V. Vas deferens, first V, seminal vesicles, second V. So this is seminal vesicles. And then this is within the prostate, so it's the prostatic urethra. If it was higher, it would have been pre-prostatic. Here would have been membranous. Anywhere along here would have been spongy. Okay, posterior wall, anterior wall, whatever. So now we're talking about a female. So now instead of just bladder, rectum, there's no prostate, because it's females, but there's uterus and vagina. So same thing. Also, they have an internal urethral orifice. You can tell here that the bladder is smaller compared to males. So, internal urethral orifice is from the bladder. So that's what helps to exit the bladder. The external is what helps to exit the body. So that's the last part of the body where it comes out of. So we already talked about these pouches, but bladder, uterus, rectum. So rectal uterine pouch, pouch of Douglas, vesical uterine. This is your uterus. Top of the uterus is going to be the fundus. Measuring on top of the slide, it's fun and all. Then later is the scary part when you're going down. So the things that hang off the side are your fallopian tubes. So if you use this exact picture, these are fallopian tubes. Round ligament will be coming more like up because it's going to go through the inguinal canal. So round ligament is kind of like the spermatic cord in males because they both go through inguinal canal. And this is the uterus, so top part is going to be the fundus. Everything in the middle is going to be the body. Round ligament is going to be going up. And then bladder would be anterior to the uterus, so you can kind of see the superior surface of the bladder here. Okay, broad ligament. So for the, I don't know why I can't erase, but for the uterus, the broad ligament is 3 parts. You have, and they're all mesos. So mesoalpinx, mesometrium, and mesoovarium. Let me see if there's a better picture. Okay, there's a good picture. So all of this stuff is all broad ligament. So this is your ovary. What attaches your ovary to the back of this is your mesoovarium. On top of your ovary is mesoalpinx because A comes before bottom of the ovary is mesometrium. So A comes before M. And this right here is just the ligament of the ovary that attaches it from this side. Then we already saw the fallopian tubes. Fallopian tubes will always be higher than the ligament of the ovary. So fallopian tubes are higher than the ligament of the ovary. This is just the middle or the body of the uterus. Top of the uterus can be the fundus. We saw bladder. We saw rectum. This is anterior of the uterus because it's facing the bladder. This whole thing's the vagina. So this is the posterior wall of the vagina. This is the anterior wall of the vagina. So the cervix of the uterus, that's what will be the end of the uterus. So this whole thing's the uterus. At the end, this is the cervix. Then you have this little thing opening external os that leads it into the vagina. This is also like how you check for cervical cancer in women using a pap smear. Okay, blood supply of the uterus would be the uterine. So off the anterior branch, going to the uterus, uterine artery. So this little opening at the end, external os. This thing right here, going from bladder down, is the urethra. This would have been the vaginal canal. So, not that one. And then if they just asked for just this opening right here, it would have been internal urethral orifice. But they didn't. They asked for this whole thing here. Here, we already saw the ovaries. What else? This is part of it, called the infundibulum. And then the things that stick out are the fimbriae. These are kind of cool because they like sort of bring like things towards the ovary, or bring the ovary toward where it needs to go. So that's kind of cool. Those are called fimbriae. What hangs the uterus up, let me find a good picture. So the uterus will be suspended up by this thing called a suspensory ligament. And it's cool because it'll go straight to your ovaries, and then it carries within it the ovarian artery and vein. So over here, this is the suspensory ligament that has the ovarian artery and vein. Now, they cut the suspensory ligament so you can see them, but it would be a ligament that closes this off, and it goes straight to your ovary. Pouch, nothing's highlighted here. I doubt she'll use this. I feel like she's gonna use anything. She's gonna use like the actual images. Over here, we said, so ovary, this all whole up thing is mesoalpinx. Lower, everything lower there would have been mesometrium. What actually pulled the ovary back against this thing is the mesoovarium. But we don't have to know any of this stuff. So this is uterus. End of it is going to be cervix. External os leading to vagina. Pubic symphysis. Right behind it is the bladder. So this is a good picture. This is your suspensory ligament, which holds it up. This has the ovarian artery and vein within it. This is your ovary, so above it is mesoalpinx. Below it would be mesometrium. And then you can't see it, but behind it over here, what connects it is mesoovarium. Oh wait, sorry, you can see it right here. So this thing that connects it to the back is mesoovarium. What connects the ovarian ligament here, ovarian ligament, this is the uterus, so body of the uterus. Top would be the fundus. And then we just saw the infundibulum, and the outside things are the fimbriae. And then same thing here, again, and again, and again. We already saw the rectouterine pouch. That's the posterior fornix I was talking about, where you actually puncture to get to the rectouterine pouch and drain any fluid over there. Again, uterus, cervix, external os, vagina. And then the vestibule in the vagina. So these are your labia minora. This is the labia major. So vestibule will be within the minora. So if she asks, it's within the minora. So this is your vagina. So first minor, then major. Vestibule is within the minor. And so perineal body, between the anus and the vagina in females, that's where it is. In males, there's no vagina, obviously, so it would be between the anus and the scrotum. So it's that space between the anus and what comes after. So in females, vagina, in males, scrotum. Here, the thing that goes up, we said is the round ligament. This is equivalent to the spermatic cord in males because it goes through the inguinal canal. A lot of the stuff I keep adding is like clinical stuff, probably better for like the written part. I'll just focus on the pictures here and the highlighted stuff she has. And then this right here, the little extra things at the end are your fimbriae. I hope this was helpful. If not, I'm sorry. And good luck. Bye.